Good morning, ladies and gentlemen. I'm Carl Ross of the University of Portsmouth, the United Kingdom. I'm a specialist in submarine pressure hulls, and today I'm going to talk to you about how in 1987 I invented a structure which could be used in medicine. I published a paper in the Journal of Ship Research in the USA. Under external pressure, a thin walled circular cylinder can implode at a fraction of the pressure to cause the same vessel to explode under internal pressure. The external pressure to cause the vessel to implode could be 1/55th of the internal pressure to cause the vessel to explode. The circular section tube I invented was a corrugated structure which gave the pressure vessel considerable strength to withstand external pressure together with internal pressure. Recently in Russia, a plastic tube of this corrugated shape was used to repair a fractured windpipe of a patient. The surgeons covered the tube in the stem cells of the patient so that the tube would not be rejected by the patient's body. They stitched this tube to the remaining parts of the patient's windpipe, hoping that the stem cells would make the repair more permanent. The patient is now able to speak and breathe normally. I will now show you the video of the successful operation. I am not medically qualified, but can this method be used to cure colon cancer and cancer of the esophagus, together with other damaged or diseased tubular organs? Thank you.
Medical or surgical procedure, you have a balance to strike. On the one hand, there's the needs of desperate patients. On the other hand, you want to be sure that it's safe and effective. So how do you get that balance right? Well, surgeon Gabriel Weston has been to see an operation where the potential benefits are huge, but where the critics say it is just not ready to be tested on humans.
7 years ago in Ukraine, Dmitry Onogda was involved in a serious road accident. His windpipe is so badly damaged that he can only breathe through a hole made in his throat. His injuries left him unable to speak. He communicates with whispered, almost incomprehensible sounds. Since his accident, he's had multiple operations, but surgeons haven't been able to repair the damage to his throat. Dmitry's only hope of being able to breathe and speak normally again is to have a new windpipe, so he's agreed to undergo an experimental procedure.
The surgery that I've come to see here today in Russia is certainly boundary pushing and indeed highly controversial. The patient's getting a new windpipe, but not one from a donor. Instead, it's been built especially for him using a synthetic scaffold and his own stem cells.
Making new organs from a patient's own stem cells is still highly experimental. Professor Paolo Macchiarini at the Karolinska Institute in Sweden has travelled to Russia to lead this trial.
The patient had a car accident, had multiple surgeries, and then complication over complication of these surgeries. Here is the point where you have your vocal cords.
Paolo's team extracts some of Dmitry's bone marrow and then isolates stem cells from it. Stem cells have the potential to transform into any type of cell in our body. The hope is that they could be used to repair organs or grow healthy new ones. In Dmitry's case, Paolo hopes to grow him a new windpipe or trachea. The team uses synthetic scaffold woven out of tiny fibres. On its own, Dmitry's body would reject it, and that's where the stem cells come in. Paolo's team take Dmitry's own stem cells and add them to the rotating scaffold. They must take great care to avoid contamination by any other cells. Then, they can only watch and wait, hoping that Dmitry's stem cells will attach to the scaffold and multiply. It seems extraordinary that the stem cells could start to form something as complex as a new trachea. The trachea is a very sophisticated piece of anatomy. How is it possible for cells put over a scaffold to grow into something that can do that very, very complicated job?
Well, we do not understand the specific entire mechanisms, but the scaffold is almost identical to the human trachea. So that means that the cells find an environment where they clearly have the chance to attach, proliferate, and eventually differentiate.
Paolo believes that once he's put the scaffold inside Dimitri's body, the stem cells on the surface will give out a signal that will attract more cells to it, and it'll gradually develop into a fully functioning windpipe that will allow him to talk normally. However, other scientists believe the evidence is not yet strong enough that the windpipe can be regenerated in this way. They feel the lives of patients like Dimitri could be put at risk by such experimental surgery. What do you have to say to those people in the surgical community who think that what you're doing is too experimental?
We have a track record on tracheal transplantation of about 26 years now, I personally. And the other thing is the surgical complexity of the case. This is a patient that has been operated on 13 times. So the difficulties and the complications are surgically related, not related to the technology.
So what you're saying is you're allowed to try this new technique on patients who ordinarily most surgeons wouldn't want to go near because of the potential complications that their cases present.
Now we are trying to prove the efficacy through the clinical study. But those that do not believe, but please give us the timing to demonstrate. Maybe we end up to say, well, it's not a good procedure, but at least we have done it.
After 48 hours, Paolo decides that the stem cells have grown enough for Dimitri's surgery to begin.
Can we have a smaller suction? Money.
It soon becomes clear that he will have to replace most of the windpipe, going down almost to the lungs. Paolo's now operating deep in the chest, right next to the aorta, which is the biggest blood vessel in the body. It's what we surgeons like to refer to as tiger country, and it's pretty treacherous.
20 minutes? No, as soon as possible. Okay. Scalpel. No, it's not lemon manipulation.
There's a lot going on at the moment. The trachea is being sewn into place in the chest, and the atmosphere in theatre is very tense now.
He is about 90, so that's not a problem. As long as it is not 40, that's okay.
You can see that it's very frustrating for Paolo to be, at times, having to operate against a language barrier.
Don't do what you want. Go up in this. I want to see the scaffold, if it is okay or not.
Yes.
So, looks perfect.
After 6 hours, Paolo is satisfied that the stem cell-coated scaffold is in place. To bring Dimitri round, the doctors shout clear instructions.
Открой рот еще. Скажи что-нибудь, Дим. Громко скажи.
Да, скажи. Молодец.
Yeah, I heard that.
He has no dysfunction of the larynx, so that's perfect.
Which is amazing.
Дим, не спал, не спал.
Дима. Everything is okay.
Все отлично.
Everything okay. Yeah, sure, yes, are you alive?
Дима.
Dimitri can breathe through his mouth for the first time in 7 years. But it's only when the anaesthetic has worn off that we'll discover whether Paolo's surgery will enable him to speak normally. I have a mixture of feelings coming out of the operating theatre today.
There's so much that has impressed me. The surgery itself is so ambitious. Paolo's technical ability is prodigious, and there is such a sincerity and warmth in the way that he talks about his patients. And yet it's hard to ignore that this is a man surrounded by controversy, and one can't help but wonder whether there isn't ever a situation where there's smoke without fire. Is there something that I should be questioning here, or is this a case for celebration?
The next morning, Dimitri is recovering in intensive care.
How do you feel differently today than you did before having your operation?
Замечательно. Я эту операцию ждал 7 лет.
You've had years after your accident of operations and not being able to talk. What are you going to do when you get out of this hospital?
Но до конца восстановлюсь и начну искать.
Your accident of operations and not being able to talk. What are you going to do when you get out of this hospital?
Но до конца восстановлюсь и начну искать, работу, девушку себе, завести семью себе, полноценно жить.
Those sound like excellent ambitions.
Но мечта сбылась, мне восстановили голос.
Dimitri has continued to make a good recovery and has left hospital, but it will be many months before it's clear whether the combination of man-made scaffold and his own stem cells will successfully work together to grow a healthy new windpipe. If they do, though, this operation could be one of the first steps towards a revolution in medicine, where our organs can be repaired and rebuilt inside our bodies using our own stem cells. More details about this research can be found on our website, bbc.co.uk/trustme.